Hey guys, it's Dr. Abraham with a sip of aesthetics, and today we are talking about Sculptra. I'm here with Lindsey. Welcome back to the show.
Thank you.
We are talking about Sculptra, which I know you love Sculptra. So let's just start by explaining what Sculptra is.
Yes, I love this topic. If I had to choose one single thing that I perform with patients that would be my favorite, it's definitely Sculptra.
Oh wow!
Yes. And it's been around a long time. It's been FDA approved for 26 years. And so it's been practiced for many years and basically shows to be very consistent and predictable in terms of improving the skin quality.
Awesome. And Sculptra, for those who don't know as much, is an injectable. A lot of times people compare it to a filler, but it's not quite a filler. It's very different in a sense, and we'll talk about that. But it's an injectable. You can do it really anywhere in the body, but most often it's done in the face to help restore some of that volume, kind of fight some signs of aging.
Yes.
Is that correct?
Yes. There's a term that people use now called biohacking, and that it's within that realm. So basically, it's a biostimulatory injectable. It's a watery solution with poly-L-lactic acid kind of dissolved inside it, and that can be injected anywhere around the face or body, but will, over the course of months, thicken the dermis with new collagen, and you can get kind of pan-facial revolumization, but in a very natural way.
And that's why a lot of people are coming more, to treatments like Sculptra and other biostimulants, but and that's kind of partly of how it's different than filler, as you were saying. It's going to stimulate your own body rejuvenation, as opposed to like a traditional hyaluronic acid filler, like a Juvederm or a Restylane, where you're actually adding the hyaluronic acid substance in the face to give it volume. Whereas with Sculptra, it's the poly-lactic acid that you mentioned is the active ingredient, and that just helps stimulate. And that's where the term biostimulant, I'm assuming, comes from.
Yes,
that you've used.
Exactly. You're kind of triggering the body to rebuild new collagen. And the way it works is by causing just a little inflammatory response underneath the skin, which forces the skin to have to repair and reproduce new collagen. Fillers, on the other hand, are more so a gel implant, basically, that you're using to create structure, a lot of times down at the bone or in the fatty layer, whereas this shines mostly kind of right into the deep dermis, so it's a little more superficial.
And you've already kind of talked a little bit about this, but like for those who are listening, who would be a candidate? Like who should be, let me consider Sculptra, or let me ask my provider about Sculptra? Who do you usually recommend it to?
The way that I kind of counsel patients is that whatever kind of age you start is where you really preserve. So ideally, you're treating someone that hasn't had severe aging occur. Anywhere between late 30s and mid 50s is ideal. All skin types respond well to it, male, female. If you have autoimmune conditions, sometimes that can inhibit your response to it, usually because of the medications that inhibit inflammatory reactions in the body.
Perfect. I love Sculptra. We use it all the time too. And we're talking about skin rejuvenation, but it also can be used in other areas of the body. A lot of time with the non-surgical enhancement, I know Sculptra is used just to kind of add volume non-surgically in that area as well.
Yep, just to strengthen the skin. It'll help kind of improve the volume slightly, like around the butt, abdomen, neck, chest, really anywhere that you put it, it's going to improve the texture and elasticity of the skin.
Would you say in the last few years you're seeing like more demand? Because like you've mentioned biohacking, and that is, like a word that's coming up more. Biostimulant, which is, again, like stimulating biologically, bio from biology, and stimulating because it stimulates your own collagen. Those are things I feel that people are now more aware of, and they are looking for more, natural ways of enhancement. And in my experience, I've seen like people ask more about treatments like Sculptra. There are other things that could be considered biostimulants. It's not like the only biostimulant, but it's definitely one of the most common ones.
Yes.
Been around for a long time, as you've mentioned. But have you noticed that kind of trend of more people doing that as opposed to traditional?
100%. I'd say I've been treating patients with it for 10 years, but in the past 2 years, people are becoming more and more aware of it, inclined to do these types of procedures, because there is a place for typical dermal fillers, hyaluronic acids, but that only treats one depth, and the body ages in every single depth. There's some theory about Sculptra also inhibiting bone breakdown if injected deep. However, through histology and newer research, it really shows that it thickens the dermis, which is more superficial than where we treat with fillers and Botox.
Now, in terms of the results, what would like a patient expect? Because there is still maybe a time and place for filler, depending on when the patient maybe wanted these results. People love Sculptra because it's natural, but like, what should they expect in terms of like the duration? When do they see the results? What's the process right after the treatment?
Yep. So over the course of about a year, if patients have never done Sculptra before, they will come in for a series of treatments. Usually I split mine into 3 treatments, and we determine the dose, usually based on their age or their skin integrity, but they'll do anywhere from 4 to 6 vials on average over the course of 1 year to build significant collagen. And then it's kind of a once a year treatment indefinitely. And my Sculptra patients just maintain their skin quality so well. They don't feel like they have to come in for other treatments as readily as the patients who don't do Sculptra do. After the injection, they can have mild swelling and soreness, and they massage the face for about 5 days afterwards. Over the first month, they usually get kind of a glow within the skin. Nice. And a little bit of fine changes, but it takes the body about 100 days to form new collagen. So really, it's between 3 and 5 months that type 1 and type 3 collagen is actually produced in the body. So it's a gradual change over about 3 to 5 months.
I see. And that might be one of the, like, it's the two sides to the same coin, is that because it's like natural and there's like natural changes in your body, it's in a sense anti-aging, like you're going after the problem, but it does take some time. So like, maybe for somebody who is looking for like the perfect results in a week or 2 weeks because they have an event, that might be like not the ideal client for Sculptra, but for general, long-term anti-aging, I can see why you love that treatment, and I love it too.
Yes, long-term, it's very beneficial, but shorter-term, you can't get results very quickly.
And this isn't like specific, I say like this isn't specific to Sculptra, but a lot of times when we see a treatment, whether it's a laser or a biostimulant or other treatment, where we're actually trying to reverse some of these signs of aging in the body, and we want the body to kind of naturally do the healing, the rebuilding of collagen, replacement of collagen, it's going to take some time to see the results, but that's also why you get these natural results, and it's definitely worth the wait.
Exactly. You kind of trigger your body to rebuild itself, and then you always yield a very healthy, nice quality skin, and you avoid any kind of unnatural effect.
Now, Sculptra is, a medication. It has to be injection. It has to be done with the, right provider. So, any specific advice for somebody who wants to do Sculptra? Like, I'd imagine you definitely want to get it from a licensed physician.
Yes.
Or, provider.
Yep, absolutely. Do your research and find somebody who has good experience with Sculptra. it's very forgiving as opposed to some other treatments, even compared to Botox and filler. It can be a little more forgiving in terms of adverse events. There's very few adverse events that occur with Sculptra aside from possibly bruising or a little bit of swelling. If patients read about it in the initial FDA trials and reports, there were reports of some people getting lumps and bumps, and that occurred with their initial dilution that was very thick. So I always counsel patients that since that time, the dilution has changed, so it's very thin, but it still yields the same collagen production, but usually we don't see any lumps or bumps or delayed issues from it.
Gotcha. And it's those PLLA particles that you've mentioned that cause that collagen stimulation. So, and that's why sometimes, like when we also do treatment for clients, we ask them to like massage it and stuff just to kind of spread these little seeds all over the face.
Exactly. And because when it was a thicker solution, it was to kind of avoid those lumps and bumps and to just keep the skin nice and smooth. Now it's still recommended to massage, but yeah, it's mostly just to be very cautious and keep the product spread around.
As you mentioned, it's one of the treatments that when done right, it's relatively, very safe. Now, obviously, every treatment, every medication has its potential side effects, just like anything else. So you want to be, informed. But typically speaking, relatively speaking, it's very safe. Now, I've heard horror stories, but usually these are people who are, getting Sculptra again somewhere like where it was somebody who's untrained. So it's not even sometimes a Sculptra, it's like the method it was done.
Yeah.
If it's not done at the right layer in the skin, it's not going to do what it's meant to do. So it could be, best case scenario, a waste of your money, but in a worst case scenario, it could be much, more complications. You want to make sure that they're actually using the actual product, because I've also heard of people using, other biostimulants that aren't, and there are other biostimulants that are also like, FDA approved and are appropriate treatments, but not just anything can be, used in place of Sculptra if you don't know where they're getting that product from.
Yes, absolutely. You should make sure that your injector is legit. I usually show patients like personal before and after photos that I have to explain kind of expectations from it, because it can be subtle but still very significant. And overall, most people, when they know what to expect, are so happy with the product and are religious about doing it every year just to maintain their skin appearance.
Perfect. Now, sometimes people are doing these kind of treatments again to help fight their aging. For somebody who's planning on possibly doing like surgery or like a facelift in the future, do they have to avoid Sculptra? Because that's also like something that I've heard some people say.
Yeah, there's a big topic of conversation usually at aesthetic conferences about, is Sculptra causing fibrosis or scarring or any other problems that can affect potential surgeries in the future or other treatments. And now there has been a new study where they've biopsied a number of patients that have had Sculptra and have only found type 1 collagen in their study. Typically, surgeons that I've worked with in the past will have patients avoid doing Sculptra about a year from when they want to do their surgery. And that's just to avoid kind of dissecting or performing surgery on tissue that might be in the middle of its process of rebuilding. And in that stage, it can be harder to dissect the tissue. So they kind of wait until all of the collagen production and all of the healing is totally complete, which can be up to 7 months, before they do surgeries. But really, the patients that kept their skin quality nice, kept collagen boosted in their skin, typically would heal better than patients who didn't maintain the quality of their skin as well over time. So their healing, their surgical maintenance is all improved if they've boosted their skin quality prior.
Yeah, that makes a lot of sense. And, I've heard of that, statement too, but I know a lot of surgeons who do surgery and they also do Sculptra, and, they don't see a problem at all doing both. And, Yeah, it shouldn't be a problem. Now, just like any other procedure, if you're doing surgery in the next few months or even up to the next year, there might be certain things to avoid just in terms of like to allow the skin to heal, as you've mentioned. So definitely we'd want to know if you're planning on doing surgery in the next few months. But if you're just thinking about doing surgery in like 3, 4, 5 years from now, it's typically not a problem. For
Yep,
most
and
clients.
some surgeons are just, they kind of have their own regimen. So some
For
are
sure.
very strict about when they want it stopped. Some want you to avoid Botox and fillers or Sculptra prior to surgery. Some want to dissolve fillers prior. So it really is dependent on their practice as well.
For sure. For sure, yeah. You always want to talk to your provider and to your possible surgeon and kind of like, especially as the time gets closer and closer to that surgery, as you've mentioned.
Exactly.
Awesome. Well, it's great having you.
Thank you. I love being
Always
on
a
your
pleasure.
show.
We'll have you back soon, I'm sure. Thank you guys for listening. We'll have another episode in 1 week, so make sure you subscribe, you like, comment, send us any message or any questions, any topics you want us to talk about, and we'll see you soon.